COVID-19 gives rise to unique partnerships, bringing vaccinations to underserved and hard-to-reach communities. The partners are comprised of the Sussex County Bookmobile and Outreach Services, Sussex County Emergency Medical Services, and BB Healthcare. Owned and operated by the Sussex County government in Delaware, under the direction of the Department of Libraries, Sussex County Mobile Library has 2 outreach vehicles managed by a 2-person staff. The Bookmobile is a 1998 Thomas-built bus that is used at daycares, developmental centers, public stops, and serves as the library for several schools. This bus was used for vaccination clinics. Our baby Bookmobile is a Ford Transit van used for deposits to daycares and lobby stops at senior centers. Sussex County is the southernmost and largest of Delaware's 3 counties. It is home to numerous seaside resorts, small towns, industry, and agriculture. The eastern part of the county is coastal and heavily focused on tourism, while the western part of the county is primarily agricultural. In June 2021, the Delaware Division of Public Health reported that Sussex County, Delaware had 51% of their population fully vaccinated, the highest in the state. This number is, however, deceiving. When it comes to vaccines, Sussex is a county of striking contrast. The beaches boast the highest percentages of vaccinations in the state, but only a short drive west the numbers plummet. On August 13, 2021, the state vaccine tracker showed the eastern town of Lewis at a 74.5% fully vaccinated rate and nearby Rehoboth Beach at 73%. However, the town of Delmar in the southwest part of the county on the same date was at 32.6%, and Greenwood in the northwest section of the county was at 32.9%. Robbie Murray, Director of Sussex County Emergency Medical Services, or EMS, and Kimberly Blanche, Community Service Manager for Population Health at BB Healthcare System, had worked together previously and were concerned about the disproportionate distribution of the vaccine in the county. They knew the best chance of getting the vaccine to these underserved communities was to bring it to them. But how? Neither had a mobile unit. When asked how the idea of using the Bookmobile for vaccinations came about, Robbie Murray said, "I looked out my office window and saw the Bookmobile sitting there. We needed to get the vaccine into the community. Why not use the idle Bookmobile?" Normally, the Bookmobile would be on the road, visiting schools, daycares, nursing homes, developmental centers, and attending community events. Due to COVID-19, the Bookmobile had been parked since March 2020. Staff had already been evaluating ways to help with the pandemic and quickly agreed to join in. On Tuesday, March 10, 2020, the Bookmobile parked after a normal run. On Thursday, March 19, 2020, county offices closed. Bookmobile staff had the challenge of keeping our aging 1998 bus running. During shutdown, staff came in just to start and drive her. We were not, however, allowed to leave the parking lot, even after staff returned to working in the office. We were approached about using the Bookmobile for vaccinations almost a year to the day from when we were pulled from the road. After a year of driving in the parking lot, staff were excited to return to the open road. Why the Bookmobile? It was available, and neither BB nor EMS had a mobile unit. The staff of the Bookmobile already served some of the targeted communities, and so were familiar with these areas. Staff knew they would be facing vaccine hesitancy and felt that the Bookmobile would be less threatening, especially since some communities were already used to seeing it. It had ample workspace and a good layout for traffic flow. Tents could be set up to serve as a waiting and monitoring area. We wanted to do more than just provide vaccinations. We wanted to provide community education and library resources. The 15-minute wait time after the vaccine was the perfect opportunity. The Bookmobile would offer free books, DVDs, library card sign-ups, and information on library programs. EMS would provide hands-only CPR training, and BB would offer Narcan kits and training. Eastern Sussex County is known for its scenic ocean beaches, upscale resorts, million-dollar homes, and expensive shopping and dining. Yet not quite 30 miles west are communities that have been rooted in poverty for decades. One example is Coverdale Crossroads, an unincorporated area with a population of 2,000 with high rates of unemployment, teen pregnancy, drugs, violence, lack of education, lack of public transportation, and high COVID-19 cases. For many, traveling to get a vaccine also meant losing a day's wages. These were the communities we needed to target. Sussex County is the birthplace of the broiler chicken industry and country's leader for chicken processing. It is also home to Sea-Watch International, the world's largest harvester and producer of clam products. Due to working conditions, COVID-19 has run rampant through the plants. The need to get shots into these areas was identified early on as critical to protect the nation's food supply. Bookmobile staff would drive to the location, transport equipment between sites, provide information on the libraries, set up book and DVD giveaways, would be responsible for handing out vaccine information, handle registration, and help with monitoring. BB staff would provide the vaccine, set up sterile stations in the Bookmobile, enter registrations into computers, train and distribute Narcan kits, and answer medical questions. They would also be the point of contact for advanced registration and scheduling events. EMS staff would monitor patients after receipt of the vaccine, have equipment ready to handle medical emergencies, and train people in hands-only CPR. All staff would help with setting up tents, tables, and chairs. There would be 2 vaccination stations on the Bookmobile. The back of the bus would serve as a station for storing and preparing the vaccine and data entry. Tents would be set up outside for registration and a waiting area. April 13, 2021 was the official kickoff. Our first stop was at the ACE Peer Resource Center in Georgetown, and the other at the Town Park in Frankfort. The day was met with quite a bit of fanfare to celebrate our start. County officials representing both the Department of Libraries and EMS were there. Additionally, Dr. Tam, the CEO of BB Healthcare, is shown here giving a tour to nursing students. The event also brought quite a bit of press attention, television, and newspapers. One of the identified underserved areas was the food processing industries in Sussex County. They had high COVID-19 and low vaccination rates. At first, we were hesitant because we knew there had been numerous vaccine clinics at these locations, but we quickly realized we were needed. This was exemplified by a woman who told us she lived in a hotel 30 miles away, took a bus to work, and worked a 12-hour shift. She took a bag of books and got the vaccine because she said we made it easy, and now she had something to read on her bus ride and long nights. Many of the communities that we visited had low vaccination rates and a high distrust of the vaccine. Vaccinations were never forced on a person. Instead, the nurses tried to gently educate. At one stop, a woman said she wanted the shot but was scared. The nurses spent over 15 minutes with her, answering questions and reassuring her, but leaving the final decision in her hands. In the end, she did get vaccinated. When she came back for her second shot, she brought her children. She went from being fearful to entrusting us with her children. We did find that the numbers increased greatly at second visits as trust was built. By kickoff, we had a new partner, First State Community Action Agency. They were already working to bring the vaccine into the same areas we were targeting, and had a relationship in these areas prior to COVID-19. The communities were familiar with them and trusted them. Many times they would go door to door prior to an event handing out flyers. They provided food and hygiene items and offered additional resources such as cooling and heating assistance. So many going into the bus were nervous and scared. Spontaneously, we started to clap and cheer when they came out. We tried to make it a celebration. It helped lighten the mood, and we could often feel the smile under the mask. As time went on, events took on more of a community fair atmosphere. We offered story times, games, and food. We also branched out and partnered with other community organizations such as local restaurant association, entertainment venues, and botanical gardens. Some of the venues offered free meals, admissions, even gift cards to entice people to get vaccinated. We attended several large festivals, including the Nanticoke Indian Powwow and annual Home Expo. Shortly after we began the Bookmobile vaccination clinics, Pfizer was approved for children ages 12 and older. The first events after approval proportionately had more children than adults. BB Healthcare vaccinated their first under 18-year-old at a Bookmobile vaccination clinic. Through a grant from Delaware Health and Social Services, we were also able to provide free COVID test kits. The kits were a welcome addition to vaccine events. Those who were vaccine hesitant could at least be provided with a test, and those already vaccinated were offered an extra level of protection. Here are a few scenes from some of the events. We were excited to have the New York Times reach out to feature us in an article they were doing on mobile vaccines. A photojournalist spent the day riding with us as we went to 3 different locations. Everyone worked hard to make the day a success. Even Dr. David Tam, CEO and president of BB Healthcare, pitched in to help set up tents. They haven't gone for a shot, so shots are coming to them, was the title of the New York Times article, May 20th, 2021. We have incredible pockets of poverty in Sussex County, and COVID has just really highlighted so many of the disparities that have been present. When it comes to vaccinations, literally meeting people where they are is so important. We are just creating that ease of access. We call it the Magic Bus. Kimberly Blanche, BB Healthcare Population Health. After the New York Times article was published, we were contacted by a small town in Georgia, wanting us to take the Bookmobile there to vaccinate their community of 150 people. While we were unable to do that, BB and EMS were able to use their contacts to help them receive vaccinations. A woman in Minnesota contacted BB asking how they could make something like this happen in their community. And it led to BB receiving the following email. Dear BB Health Outreach, I read about your vaccine bus in the New York Times. Thanks for supporting your community. Cooper Hewitt Smithsonian Design Museum is organizing an exhibition this fall, Design and Healing, Creative Responses to Epidemics. We would love to feature photographs of your bust in our exhibition as well as in our book, Health Design Thinking. Sometimes we hit bumps in the road, literally. The original goal was to offer the J&J vaccine. The thought was if we offered J&J, we would not have to repeat stops and could focus on getting more shots into the community. The day of our first event, however, the use of the Johnson & Johnson vaccine was paused by the FDA. Fortunately, BB was able to get Pfizer, but we were now committed to a second visit. Permission was granted to use the J&J vaccine 10 days later, but faith in it was eroded. the first thing people would ask is, "It's not that J&J, is it?" Because the Bookmobile does not have exterior lights, we were limited to events held during daylight hours. Unfortunately, targeting housing developments on a weekday morning is not ideal for reaching people. We discussed trying to set up portable lights, but in the end decided not to hold events after dark due to safety concerns. The Bookmobile does not have an awning, and so we were forced to rely on tents, which needed to be broken down and set up, sometimes 3 times a day. At some events, we had so many tents we jokingly called ourselves Tent City. Sometimes we had to say no. There was a higher demand for the Bookmobile vaccine clinics than availability. All the partners also had other duties and responsibilities, and sometimes we just couldn't fit an event in. From one vial of Pfizer vaccine, nurses could draw 6 to 7 doses. Unopened vials could be returned to the hospital, but open vials needed to be used. Wasted doses were frowned upon and led to a long paper trail. Due to the hard work of staff, we were well into our clinics before a dose was lost, and by then demand had eased. We became creative at finding arms for extra shots. At one stop, the director of EMS stood in the road flagging down cars. Staff would go through their contact list. BB staff would even go into grocery stores and restaurants, stopping people to see if anyone wanted a shot. In some areas, English was not the primary language. The 2 languages we most encountered were Spanish and Haitian Creole. Sometimes BB was able to provide a medical translator for the event, and at others they were provided by the sponsor. Often, it was staff relying on high school Spanish and French, hand gestures, children translating for parents, and even people having friends and family translate over the phone. All the paperwork, including the registration form and vaccine information, as well as event marketing material, was made available in those 3 languages. In addition to the New York Times article, there were 29 separate articles that appeared nationally and locally. We also appeared on 3 local news programs. Next, we plan to continue our partnerships and have already discussed holding a health fair targeting some of the same areas. BB has stated one of the difficult parts of doing community screenings and health fairs is that people come as a family unit. We offered that Bookmobile staff could provide story time and crafts for the children while the parents were getting screened. The Cooper Union Smithsonian Design Museum in New York will be including the Bookmobile Vaccination Clinics in its upcoming exhibit and book, Design and Healing, Creative Responses to Epidemics, running December 10th, 2021 to August 14th, 2022. Both BB and the Sussex County EMS have successfully written grants for their own mobile units. They feel the experience on the Bookmobile gave them an edge in the process. How did we do? 899 vaccines have been given. 543 test kits have been handed out. And we are still going.